And we are broadcasting live at Nesha Medical Practice. Dr. Makemba, thank you for always hosting us. How are you?
I'm doing very well, and you are definitely welcome. It's always a pleasure hosting you.
Great, great. Nesha Medical Practice, where are we situated for the new viewers?
Yeah, we are just situated across from Central Hospital main entrance. We are in Oyefa Street, F209. Yeah. Our contact detail is 061 22 0778. That is 061 22 0778. Anybody that might want to use it for services, they're always to contact on those landlines, and then we'll be really available to help them.
The friendliest staff in town and always on standby. I don't know how you do it, Doc, but thank you. Last month when we were sitting here, we spoke about Down syndrome. Tonight it's about malaria. Why this specific topic?
Malaria is one of those conditions that we commonly see in our setting, particularly in our country. It's very treatable if picked up on time and promptly managed, but obviously if individuals often pick it up and they don't know where to go, who to look, for help, it can also carry some complication that might actually end up, with individuals losing their lives.
Yeah, deadly disease.
Yeah.
A few weeks ago, not long ago, Yvonne Chaka Chaka, she had a post on her sister that died of a treatable disease. Let's get into it, Doc. What is malaria?
Malaria is a disease that is caused by a parasite. We call this parasite falciparum, Plasmodium. It's often transmitted through a bite by a female Anopheles mosquito. In our setting, it's quite common in the far northern part of our country, the 4O region, that is namely Omusati or Angwena or Shikoto and Oshana. And then northeast, which is Zambezi region, Kavango, western east, and some part of Kunene region. Primarily because that's where you find the population of the said mosquito that often tend to transmit this kind of problem. Yeah.
It's good that you shared the location, mostly in the demographics, the 4 O's. Yeah. Are there any, leading factors that cause these specific parasites? I've always heard about if there's more water, you're more prone to those mosquitoes. Maybe give us some more insight on, on which specific locations in those areas can you find these?
Yeah, if you look geographically, if you look at the 4O region, namely Ohangwena, Omusati, Oshikoto, and Oshana, they often have this, open, rivers, and the flood that often comes in, especially when the region is flooded at that time when the water coming from Angola. These mosquitoes tend to breed in those areas. And then that's the same apply with the Kavango and the Zambezi area and part of Kunene region. And the population of the said mosquito, which is a specific female Anopheles mosquito, tend to be very, concentrated in that area. And obviously, that, becomes then the season where you tend to see mainly, this kind of problem, happening, particularly during the rainy season, when, the rivers, are now, flooded in this body of water collecting around the villages and the farm areas. So the mosquitoes, they tend to breed, and when they breed, obviously at night, they do bite people that, often live in this said area, and that's how they end up contracting malaria.
Who's more prone? Can we say females, children, a certain blood type?
Probably, individuals that are at an increased risk, first and foremost, are the people that live in the said area. So which means people that are living in those regions, they are at an increased risk of contracting malaria, particularly during the rainy season. Younger children, and infants are also at an increased, risk because their immune systems are still naive. You talk of the elderly because, when you become old and frail, your immune system is not as strong anymore. Pregnant mummies and their babies are also at an increased risk. Individuals with chronic illnesses such as diabetes, cancer and so forth are also at an increased risk of developing and contracting malaria during the said season. And then you're also looking at travelers. If you do travel into the said region, but you emanate from a place where there's no malaria, meaning that you have not been exposed to malaria, you yourself also then become an individual that is at an increased risk of developing and contracting malaria. Should you travel to the said region at that particular time when there's a whole lot of body of waters in the rivers.
So if I'm traveling and I want to be safe rather than sorry, do we get an injection? How do we prevent getting bitten by that specific mosquito?
There are actually, prophylactic, tablets that one can take. There's quite a wide variety on the market. It's just a matter of, getting into a general practitioner's office. Some of them can be taken a week before you travel while you are there, and then continue taking a week after you have left. Some are quite, better because you might just have to take, 2 tablets, one before you go, and then one when you're in the region and when you come out of the region. And obviously, we also, encourage individuals to use mosquito nets. If you're in the said area, maybe you checked into an establishment or you're at home, have a mosquito net that you sleep under the net at night so the mosquitoes don't get to bite you. There are also, long-sleeved clothes, like, the long Joneses.
Yeah.
When you go to bed, obviously you are covered up, and then, the mosquitoes won't bite you. And obviously there are insect repellent, creams and ointments that one can apply. And then also, if you go into shops, they do sell these mosquito coils where you bend them and that smoke sort of, keep the mosquitoes away. If you do that, at least you reduce the risk of the mosquitoes getting access to you and biting you and then transmitting, the malaria.
So are the pills 100% guaranteed, Doc?
Yeah, they do work. I mean, speaking from clinical practice, having been around for a while now, I've had people travel as often to that said region and part of the country, and they often do come through and say, Doc, I'm going to travel this time of the year, I'll be gone for a week or two, can you please, prescribe me something? So I tend to give them, the prophylactic tablets, and by far, I think the success rate has been 100% so far. I haven't really had somebody who I've put on prophylactic management and then they come back with malaria. So they always come back and they are fine and there's no issues. So if you do take it as prescribed and, as per instruction, the likelihood is that you're going to do well.
So how do we know I get bitten by a mosquito? How do I not panic? How do I look out for those symptoms that it may be malaria before it gets too advanced?
Yeah. If for instance, you have traveled to the said region and now you have, returned, if you do develop a fever, for instance, and chills, headaches, joint pains, muscle ache, some of the people report abdominal pain, nausea, vomiting. You tend to have a rapid shallow breathing, we call that a tachypnea, or sometimes your heart might be beating very fast, we call that a tachycardia. Some people might even develop a cough, just generally feeling unwell, In fact, talk of, the symptoms. Last night I was on call and I had a gentleman that had traveled all the way to Wakana.
Yeah.
So he came to a casualty unit and he wasn't feeling too well. He was just a bit weak, offish, feverish, nausea. He had a few episodes of vomiting. Those are the kind of things that you look out for, and especially that coupled with the history of having traveled to the said region. With malaria, you must always look into the history. So when they have traveled to the said region, you probably have to look out, for the possibility of the problem being malaria, especially when the season in which they've traveled is a season where the mosquitoes are actually, breeding, and there's a lot of bodies of water there, and then, there's a possibility that I've been exposed, bitten by the mosquito. So you can then run some few tests and then, make sure whether it is or it is not there, and then you treat accordingly.
Okay, great. So let's get to the point where we are diagnosed that it is malaria. If you were proactive, you felt these, symptoms, these signs, what happens from there, and what kinds of medications or treatments do you refer them to, Doc?
All right. When an individual now present to us, and then we establish from the history that they have traveled to the said area and the symptoms in the background that are suggestive, we first take the blood. We can either do a rapid malaria test where we just get the test result within 5 minutes, and if you don't have those devices, you can send off the blood to the lab where they do a peripheral malaria smear, and when the result is then reported back to you, we do have actually a regime that we follow in our setting that we put our patients on. Depending on the severity of the symptoms, you then have to choose whether I'm going to treat this patient as an inpatient, meaning you have to admit them, keep them maybe for a few days while on the medication. But if you pick up the problem early enough and there's not much in terms of presentation, the symptoms are not as significant, you can also give them oral medications where they go home and take the medications. The medications have demonstrated to work and they are very effective. We've seen them save a lot of lives. And when it's given on time and promptly, and the problem is picked up on time, the outcome is often good if you do manage it properly.
Okay.
Yeah.
So if we're one of the lucky ones that it is treatable, we've detected it, how long is this process? Do you go like in a relapse? Do you pick it up again? Are you more prone? Are you less prone once you have, picked up malaria?
If you have been treated and you have been declared cleared of malaria, the likelihood is that it's gone.
Yeah.
For you to pick it up again, it might then mean having to go back to the said region, getting bitten again by a mosquito. But it won't just recur or come back, after you've been treated simply because you have had it. Obviously, there are quite few complications that can arise from, having had malaria or having picked up a malaria. It can spread to the brain, then you end up getting what we call cerebral malaria.
Wow.
That can be very dangerous. If it's not treated, you might slip into a coma. If it goes to the spleen, it might cause the spleen to rupture, and then you can bleed, exsanguinate, and then you might die. It can also cause damage to the liver. It might make your hemoglobin goes down, and then you become anemic. These are some of the complications that can arise should the problem, one, not be picked up on time, or not treated properly and promptly. And when the complications arises, oftentimes people that end up unfortunately losing their life are those that have developed complications. But in a nutshell, if you're treated and cleared of it, you're most likely not going to have it recurring unless you travel back to the region and then you expose yourself, and not take care of yourself and protect yourself from the malaria, carrying mosquitoes that are said to be in those regions.
There are usually stigmas of all sorts. If you have a family member that's been diagnosed with malaria, how does a family care for that person? Does it become that frail and ill that you need to have extra support? And just confirm, is it contagious or not?
Yeah, first and foremost, it's not contagious. In other words, it's not a communicable disease. In other words, if your life partner, for instance, have malaria, if you get intimate with them, they're not going to pass it on.
Okay.
If you are sharing, you're living under the same roof with somebody with malaria, they are not going to pass it on to you. You have to be physically bitten by the said mosquito, the female Anopheles mosquito, and then it then transmit that, Plasmodium falciparum, which is a parasite. It has to happen that way for you to pick it up. But if somebody in your household has picked it up, they are not able to transfer it or transmit it to you. But obviously, if an individual is very sick and frail and the diagnosis has been established, there is a likelihood that that individual need to be hospitalized. It's very seldom that you find people very sick knowingly that they are sick from malaria and they are just at home and doing nothing, unless maybe in a very remote area where there's minimal access to health facilities. It does happen sometimes, but by far, if somebody is found to be at home very ill with malaria, the likelihood is that they don't even know they have malaria. They probably just think they've got an illness of some sort. But by far, when they are presented to the health facility and a diagnosis has been established, there is a less likelihood that the clinician or the healthcare worker will send somebody with malaria who is very sick back home. The right thing to do and the most likely thing to do is to probably have them, hospitalized and institutionalized in a hospital where they are managed and kept maybe for a week or so, a few days, depending on how quickly they recover. And when they're out of the wood and they're feeling much better again, then they get released back and then they can go home.
Okay. So, Doc, there's so many, deadly diseases out there. 1 month we can be speaking about cervical cancer, then HIV/AIDS, and SRHR. Let's compare malaria to, where do we stand ranking in Namibia? Is it very serious? Have we been increasing over the past couple of years? Has it been decreasing? What is the status quo at the moment?
I think as a country, we have done extremely very well.
Okay.
If you compare to where we are, comparing that to back in the mid-90s, for instance, malaria was such a huge problem in Namibia. People were dying by their numbers, particularly in the far north and northeast part of our country.
Yeah.
And obviously, there has been a lot of campaign strategies that has been incorporated, particularly by the Ministry of Health, through television, radio, community outreach, particularly in the said region. And there was even a time, I remember, in the late 90s where the ministry had actually engaged on free distribution of mosquito nets in the rural areas of the said region. And when that campaign has kicked off, we had seen a marked reduction in the number of new infection, death that are related to malaria. We do still see cases coming up here and there, and then there are a few deaths that are also related to malaria that we still see, particularly also because we share our border with Angola.
Yeah.
And folks from Angola oftentimes when they get ill, sometimes they do come into our shores, looking for better healthcare facilities and accessing health care services. Sometimes they also bring it in, and then sometimes when they present quite late with complications, and obviously we might end up losing a few, and those will definitely make it into our statistics because they have died or passed while they are making use of our facilities. But nevertheless, as a country, we have done very well. There has been quite a good number in terms of reduction.
That's good news.
Yeah.
And the floods didn't increase it a bit because usually when it's flooding,
that's
the numbers start going up.
That's the time. When it's flooded, that's the time when the numbers really goes up. I remember, I think a few months ago when the flood just came in, we were able to publish an article on malaria, just creating awareness. I think one of the print media, if I'm not mistaken, New Era ran the article. So the purpose was really just to create awareness. I think we have also had an one of our breakfast health segments with Radio Energy, we did discuss the topic, and also we're discussing it now. This is just also to create awareness, to make sure that our people understand the condition, and they do understand, what are the measures to take in order to mitigate the risk of ending up contracting this problem.
So comparing to the 90s up until now, reveals your age, Doc. No, I'm kidding. Do you think that we're doing enough to further disseminate the information? You just mentioned what National Medical Practice is doing. I feel that many times marketing campaigns are all over your screens, and then it like dies a natural death. Do you think we're doing enough in terms of government, the private sector, or should more be done to create more awareness?
I think there's room for improvement. I should highlight that I feel what we have done so far has, somehow, bear some fruit. We have seen, that it can be done, and if it's done properly, it can actually yield better outcomes. So people then, get to understand, they take a better care of themselves. But I still feel there's still room for us to do better. And also, especially the private sector can come on board, and join hands with the Ministry of Health, in driving this campaign. And not only drive the campaign and, providing the information, but rather also, providing, amenities like, the mosquito nets, because
like they did in the past.
Yeah, like they did in the past, because not everybody really can afford, to buy a mosquito net. And if we could have, individuals come on board, maybe buy a quite number, and then through the ministry, can be then distributed to the highly affected area where people are especially not able to afford. That can go a very long way. And obviously, incorporating these things also into our curriculums with our, school educations, teaching the little ones at, the primary level. Because, when you teach children, when they go home, they're excited about the topic they've learned from school.
And they'll share that
and
information.
And they'll share it with the parents. That's how information gets, to the grassroots level where it's needed the most. I think if we can, try to incorporate some of those, and look at the strategies that we can further incorporate in strengthening information dissemination, we tend to do even better.
Great. I've asked the who, what, where, when, why. Please feel free to, drop a comment down below. Any other questions or DM, we'll gladly answer your question. Doc, any final remarks, any comments regarding this very still relevant and important topic about malaria?
All I want to say to our viewers tonight, and those that will be watching at the later stage, that malaria is lethal. One, it kills. The complications can actually, be the one that causes problem. So the idea really, particularly if you plan on traveling to the said region, or Angwena, or Musati, or Shana, or Shikoto, Zambezi, Kavango, Western, Eastern part of Kunene. Even if you are originally from that area, you grew up in that area, but now maybe you live in a different city like Windhoek, and you're probably going back home to visit your folks, and you are going especially during the rainy season, it's always best, to make sure that you first get to see your general practitioner, go to the clinic, talk to the health professionals, find out, is there any medication in terms of prophylaxis that you can take to protect yourself for the said time that you're there? And if it be so, then, make use of the service, and protect yourself, and let's kick malaria out of the community.
Great stuff. Doc, and National Medical Practice, job well done. You're taking this on, in your private capacity, and that's what we want to see more of. Assisting government halfway.
Yeah, definitely. That's the whole point. National Medical Practice is always structured in rendering service, that helps meet the ministry halfway. So we are, in a lot of, activities, that, helps also meet the ministry halfway. And, it's not just about, rendering a private service, but it's about making a difference in the community.
Impact. Doctor, thank you so much. We'll be back next month, and feel free to share through your possible topic for the next month. We always read and we also implement. Thank you so much. Good night.